America, land of the free to choose between bankruptcy and subpar care. Why might value-based care be the solution to this conundrum, and what stands in the way of it? Let's find out in this week's Modern Problems YouTube channel video. America spends more on healthcare than any other country, almost $5 trillion a year. But despite this investment, our healthcare outcomes often fall short. So what's going on, and how can we fix it? Enter value-based care, VBC for short. Let's start with the current system, the fee-for-service model. In this approach, providers are paid for every test, procedure, and visit. Essentially, the provider makes a note of every single service they provide a patient, and then they send a bill with an itemized code for each procedure. This bill goes to your insurance, and if you're lucky, the insurance company will pay it off. If not, you're on the hook for an egregious, out-of-proportion bill that reflects the impossible reality of U.S. healthcare costs. While this might seem straightforward, it's clear there's a major problem. It rewards quantity over quality. More service means more revenue, regardless of whether they truly benefit the patient. The result? Americans pay more for healthcare than anyone else in the world, yet we rank poorly in life expectancy and chronic disease management. Going to the hospital is like playing the lottery. The odds are not in your favor, and yet worse, you're gambling both your physical and financial health. But what if we change the approach? Value-based care shifts the focus from how much care is provided to how well it is delivered. Providers are rewarded for achieving better health outcomes rather than simply performing more services. The premise is that providers are incentivized to provide quality care through compensation that hinges on predefined care outcomes. The goal is that instead of performing every test, giving every shot, and prescribing every medication, the clinician provides a treatment plan focused on results, not procedures. In this model, healthcare providers prioritize keeping patients healthy through preventative measures and effective management of chronic conditions. This means they're incentivized to improve your health rather than just treat your symptoms. When you're a nation of sick, diabetic, obese people, it makes sense to focus on the chronic long-term issues and not just whatever virus is going around. Not that I agree with the man's platform, but maybe RFK was actually onto something here. Value-based care emphasizes teamwork and technology. Doctors, nurses, and specialists collaborate using shared health electronic records, or EHRs, to ensure patients receive appropriate care at the right time. This is where the first opportunity and/or challenge comes into play. Providers spend enough time on screens documenting treatment, responding to messages, and doing a whole lot more already. Adding more of the screen time is not going to work. That's where we're seeing a huge opportunity for AI-enabled chart review, care outcomes measurement, and data analysis platforms. The CMS, which governs both Medicaid and Medicare, is playing a key role in getting these up and running so that VBC is enabled for these payers. However, we're yet to see one platform fully dominate the space, so scale is definitely an issue in this regard. The idea of objectively measuring care quality is another issue of contention. What defines quality healthcare, and how do we exactly decide what that's worth? This is another area of fragmentation, but again, the CMS is the guiding light for the industry. Most VBC-enabled organizations will use metrics defined by the CMS and supporting agencies like the NCQA. In terms of compensation, most VBC reimbursement is based on a few different revenue models designed to reward quality. First, there's performance-based incentives where providers receive bonuses or additional payments when they meet specific quality and efficiency targets, often measured by metrics like patient satisfaction, preventative care rates, and chronic disease management. There's also shared savings programs, where providers share a portion of the cost savings achieved by delivering high-quality care compared to a benchmark or historical cost. Then there's bundled payments, where a single payment is made for all services related to a specific treatment or condition, which encourages coordinated care and cost reductions. And then finally, there's capitation, where providers receive a fixed payment per patient, regardless of the number of services used, incentivizing preventative care and efficient resource management. As I'm sure you can see, it's not exactly easy to quantify what quality care is worth, and so there's no ultimate means of compensating in the VBC model. However, the shared savings model appears to be especially prevalent given the easy comparison to old, expensive fee-for-service models. As VBC matures, I believe we will see a shift to more performance-based pay as metrics are better defined and more comprehensively captured. The results are promising. Fewer hospital visits, fewer unnecessary tests, and lower costs for everyone, patients, providers, and insurers alike. However, the headaches have not all been resolved. It wouldn't be a Modern Problems video without a case study, so let's look at Humana, a major Medicare payer, where the results are clear. So looking at a few metrics regarding adoption, the number of patients under value-based care arrangements grew by 2.3 million over the past decade. And additionally, in 2022, there was records showing that 70% of individual Medicare Advantage patients were aligned with value-based care providers. In terms of quality metrics, VBC patients were less likely to spend time in the hospital as well. There were 30.1% fewer inpatient admissions for the VBC patient cohort compared with the original Medicare beneficiaries in 2022. A likely driving cause behind this is that VBC patients were more likely to receive preventative care. They received preventative screenings at a 14.6% higher rate than other Medicare Advantage members not in VBC arrangements. The financial impacts of this are quite astounding. In 2022, Humana Medicare Advantage VBC contractual arrangements saved 23.2% in medical costs compared to the original Medicare plan. On average, a Humana VBC-enabled patient would be saving $527 annually compared to those in the original Medicare program. And overall, what did this mean? Humana found that patients cared for by VBC physicians had significantly lower acute care usage and potentially avoidable events, thus showing the merits of VBC when compared to traditional fee-for-service plans. One doctor aligned with Humana even said, as our report shows, this smarter healthcare model improves outcomes for Medicare Advantage members and allows primary care physicians to practice medicine at the top of their license and develop meaningful relationships with patients. While Humana's initial findings are for the Medicare market specifically, it also cited evidence to suggest similar findings across different insurance plans. Of course, the transition to value-based care isn't without challenges. Significant changes are required in tracking outcomes, coordinating care among providers, and managing the financial risks. Healthcare companies typically spend 1 to 5% of their budget on care quality measurement, which is likely to only increase given the immense data requirements of VBC systems. And of course, there's also public skepticism and resistance from some providers who may feel overwhelmed by new data requirements and see uncertainty in the shift away from fee-for-service reimbursement, in which they've seen years and years of healthy incomes. But here's why it matters. Programs like Medicare's accountable care organizations have already shown success, reducing hospital readmissions and saving billions by focusing on preventative care. And it's not just about cutting costs, although that is certainly a benefit. It's about creating healthier communities by addressing inequities and improving access to quality care for everyone. With the CMS's early adoption of VBC programs, it looks like this new model is a viable path forward for overcoming the US's systematic healthcare challenges. However, I would reserve judgment until we see more widespread adoption. Of course, there's going to be some upfront benefits, but we need to see what it looks like when VBC is rolled out on a grander scale, as well as when there's more technological development to underpin a larger scale adoption. So there you have it. Value-based care isn't just a concept, it's a potential game changer for America's healthcare system. By prioritizing outcomes over outputs, we can foster healthier lives without breaking the bank. Of course, this requires an unprecedented level of digitalization and technological adoption, something that the healthcare industry is notoriously poor with. So it remains to be seen what will actually come of it. Thank you for watching this week's Modern Problems YouTube channel video. If you found this topic interesting, please let me know in the comments below. I'd be happy to explore any suggested topics of interest in future episodes. Thank you and have a great rest of your day.